it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units whilst providing quality services for long-term ventilated patients and medically complex patients at home, including home TPN. In last week's blog, I talked about what's my dad's life expectancy after he had a tracheostomy, and I did that in a YouTube live stream. You can watch that live stream from last week if you're clicking on the link below this video. And I do, by the way, I do regular live streams on YouTube where I answer questions for families in intensive care and also for families in intensive care at home. Go and check that out. So today's question is from a reader who asks, how long is a patient going to be sedated after tracheostomy in ICU? And I know the reason the reader has given me some context. He said that, you know, his 20-year-old son has cerebral palsy and is now at the point where he needs a tracheostomy, and he wants to know, you know, how long will his son be sedated after the tracheostomy. Now, it really depends, but the goal of a tracheostomy in ICU is always to minimize sedation. So therefore, you know, as soon as a tracheostomy is done, you should be able to stop sedation, because ventilation with a breathing tube or an endotracheal tube is very uncomfortable. Therefore, it's one of the main reasons why someone needs to go into an induced coma. And you know, you want to minimize the time spent in an induced coma. You want to minimize the time spent being on addictive drugs such as morphine, fentanyl, midazolam, or propofol. Propofol is not addictive, but midazolam and certainly morphine and fentanyl are. So you want to minimize the time spent on chemical restraints, if you will. And furthermore, you know, especially when it comes to patients with, you know, cerebral palsy, motor neuron disease, spinal injuries, you know, any neurodegenerative conditions that need ventilation, you know, you absolutely should minimize the time spent in the induced coma and on sedation, because you want to get back home as quickly as possible. And, you know, especially in your son's case with cerebral palsy, you know, he should be able to go home as quickly as possible with our service intensive care at home. Because that's, you know, a safe way to get your son home. You told me he's also ventilated, he's on BiPAP ventilation, he now needs a tracheostomy. So, you know, you should be able to go home from ICU as quickly as possible with the ventilator as well. So the only way to really make that transition possible is with 24-hour intensive care nurses and 24-hour intensive care nursing, because, you know, you need to make sure that the airway is stable, that you've got someone competent managing an unstable airway, which is what a tracheostomy is. And that's according to the evidence-based home mechanical ventilation guidelines that clearly provide the evidence that the transition from intensive care to home on a ventilator with a tracheostomy can only be done with 24-hour intensive care nursing at home. Now, I know that you are in Australia and you should be getting NDIS funding for our service. The NDIS is funding home care nursing for nurses for patients on ventilation with tracheostomy, and you should be checking that out. You should be contacting us if you have any questions about the NDIS and how to obtain funding there. I really hope that answers your question. And if you have a loved one in intensive care, you should be contacting us as well here at intensivecareathome.com. Call us on one of the numbers on the top of our website, and or send us an email to info@intensivecareathome.com. So also have a look at our case studies, because there we highlight more about what we can do for our clients, how clients can live at home with ventilation and tracheostomies, and you can look at our case studies as well. And if you are at home already and you need support for your critically loved one and you have insufficient support or insufficient funding, please contact us as well. We can help you with all of the above. And if you are an intensive care nurse or a pediatric intensive care nurse with a minimum of 2 years ICU or pediatric ICU experience, and you ideally have a critical care certificate, please contact us as well. Check out our career section on our website. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, northern suburbs, in Sunbury, in Bendigo, Mornington Peninsula, Bitton, Patterson Lakes, Frankston area, South Gippsland, Druin, Warragul, Tryda, Trafalgar and Moe, as well as in Wollongong and in Kensington in Sydney in New South Wales. Check out our career section as well. We are also an NDIS, TAC, DVA and iCare approved community service provider in Australia. Have a look at our range of full service provisions. Thank you for watching this video and thank you for tuning into today's blog. This is Patrick Hutzel from Intensive Care at Home, and I will talk to you in a few days. Take care.